Hi, I'm Susan Turk. We spoke in August.
Yes.
Yes, and I am chairing today's MOPAG meeting. I'd like to welcome you. I've already read today's Post-Dispatch article about you and your campaign to our meeting attendees. And so they know a little bit about you, and please tell them a good deal more.
Okay, so hi everybody. Ray Reid, 24 years old, the youngest candidate for Congress in the country, and the first person, going to be the first person of color to represent Missouri's 2nd Congressional District. I guess a little bit of background about me. I studied political science and criminal justice at the University of Central Missouri in Warrensburg. After my freshman year of college, Governor Nixon gave me a position on his policy team. During the last year of his administration, I worked on bill reviews and clemency applications. We got a little more than 70 folks pardoned that summer for nonviolent drug-related offenses, which is really progressive looking at Missouri now. Stayed with Nixon to the end of his administration, then returned back to UCM, working on campus with then Vice President Joe Biden's It's On Us campaign, an organization to fight sexual assault on college campuses, not just in Missouri, but around the country. Post-college, Stephen Weber, chair of the Missouri Democratic Party, gave me a job organizing for House and Senate candidates and on Senator McCaskill's 2018 campaign. I stayed with the state party a little bit in the 2020 cycle, and through my time in the state party, I hit all 114 counties and met folks from all across the state of Missouri, hearing their stories, knocking doors, making phone calls, and fundraising for Democrats. After the 2020 cycle, came back to St. Louis, working with nonprofits like St. Vincent de Paul or Fun Without Guns, just doing everything I can to help our homeless community, our veterans, single mothers, victims of domestic and sexual abuse, victims of gun violence, and of course our youth. And now I'm running for Congress. Like the article said, you know, I sat with some of my friends, and after Senator Shoup lost this last time around, and we talked about the issues we cared about, and I really wanted to get engaged by running for office. Where I lived in Brentwood, I had a great state representative in Joe Dahl. We just moved to Chesterfield, but at the time I lived in Brentwood. I wasn't going to primary a really good Democrat in the state legislature where we already have lower numbers. So I decided to run for this federal office against Congresswoman Wagner. I think, the candidate this time around just has to bring something new to the plate. It has to be a fresh face, someone that doesn't have a voting record that Ann Wagner can pull up against them. And I think the times we face these days are really unique. In the early 20th century, we declared under President Roosevelt that every citizen is entitled to, has a fundamental human right and deserves a dignified retirement in education and healthcare. Now, it took us a while to get there, but well, we're starting to see progress. We have a unique opportunity now to define what that looks like 80 years later in the 21st century and going forward. So it's universal health care. It's building on the Affordable Care Act. On day one in Congress, I'll introduce a bill to grant folks who are currently uninsured Medicare. They will automatically be entered into Medicare. Folks who have insufficient health care, they'll have the option to opt into Medicare. And if you're in a union and you worked hard to get a good contract, you don't have to leave. You don't have to give up your contract. You worked hard to get your benefits. You don't have to give that up just to jump on Medicare. You can stay on your private insurance. But yeah, sorry guys, my schedule kind of got mixed up today. I'm just leaving the Planned Parenthood rally from downtown St. Louis. But I'm open to any questions you guys may have.
Sure, Christina.
I don't want to be stepping on any toes here, but you're a young man.
Yes.
And the majority of the voters for the 2nd district will be older to middle-aged white people. Mm-hmm. How are you gonna campaign to them?
Well, a lot of our issues are shared, but it's about everyday working class folks. And we're also, like, because of my age, we're organizing. We have an army of young people who are ready to get engaged in this campaign. I talked to some folks who say, well, why don't you run for a lower office? Well, my candidacy in this campaign, we're starting to inspire high school and college kids to get engaged in the political process. And win or lose in this primary or the general election, we can say that we inspired an entire generation of young people to get engaged in Missouri's 2nd Congressional District, which makes all of this worth it. Yeah, but we're definitely making a push towards older people. But the young people is where we draw our initial strength. And what we are starting to see already is that those young kids are starting to talk to their parents and their grandparents about the world they want to live in, what they expect from their representatives and this campaign. So we're starting to make some gains with folks over 30 and 35, but it's going to take work, and we're willing to put in the work.
Harvey, do you have a question? I see your hand raised.
Yeah, thank you. Ray, I appreciate your stance on all the social issues. Living in Chesterfield, you're probably aware, I also live in Chesterfield, that there's a lot of business owners, small and medium size, etc. What kind of policies have you thought about to enhance their lives?
Right. So I'm 24 years old. I understand that. I know that the stereotype is that young people think they know everything. I understand that I don't know everything. So I'm going on a listening tour this fall where I'm not just hitting high school and colleges. We're going to start doing town halls here. I think November is our first town hall, where I'm listening to folks in the community. We're building our platform outside of the social issues around what feedback we get from the community. But early on, I could say that I'm obviously for tax cuts for the middle class and raising taxes on the wealthy. When I say wealthy, I'm not just talking like lawyers and doctors. Like, there's plenty of lawyers and doctors who look at their bank accounts and wonder how they're going to put 3 or 4 kids through college while at the same time saving for their own retirement. I'm talking about that top 1%, those Wall Street hedge fund managers and bank CEOs that Ann Wagner has protected for the last 20, 30 years.
Right. No, I appreciate that. I just want to suggest, as a friendly suggestion, that you may have a slanted audience if you're just doing town halls with Democrats. So you may want to approach Chamber of Commerce folks or some of the major employers.
That's the plan. Thank you, though. Yes, that is the plan.
Okay.
Don, you have your hand raised. Don Logue. Unmute yourself, Don.
Sorry, again, working with a little different equipment here. So apart from your difference in age, what are the key distinctions that you're going to emphasize from a policy standpoint and background standpoint with the other primary candidates?
Yeah, so I can definitely give you background, but policy, they haven't published their policies yet, and we're still putting the finishing touches on ours. So that'll come down the road, and we'll obviously point out key issues. You can be a progressive as long as you're just honest with people and you tell people what you believe. It's okay to be a progressive in a moderate frame in a district like the 2nd. But as far as background goes, I met Trish Gumby, Representative Gumby, for the first time at another Planned Parenthood event a couple of weeks ago. And I communicated to her that, I've talked to my staff and we're going to be completely respectful with her. I told her I admired her before this race. I'll admire her during the race, and I'll admire her after the race. And I admire the work she's done for the 99th district and the community of Manchester. That being said, I jumped in this race because I believe that we need someone fresh, someone new. someone who doesn't fit the mold. We've started to hear that, it's risky. He's got good ideas, but it's risky for someone young and unproven to run against someone like Ann Wagner. But I think the real risky option is to run the same type of candidates election after election and expect a different result. I think it's time for us to try something new. And then with Ben Samuels, I'll communicate the same well wishes to him, but the only background I know about him is that he worked for a Republican governor in Massachusetts, and while I worked for a Democratic governor here in Missouri.
Did I
Don, are you
hear-
done?
Well, just a follow-up question here.
Mhm.
Did I say we're not talking policy during the primary? I'm sorry. What are those ideas that you're talking about?
What's my platform?
Yeah.
Yeah, so I'm running on 3 simple core issues: healthcare, jobs, and justice. After the pandemic, everyone deserves healthcare, period. I talked about my healthcare plan that I'll introduce in Congress. Jobs, it's sectoral bargaining for labor unions, which really quickly, if McDonald's workers were to unionize and get a good contract, and the government could extend that contract to Chick-fil-A workers and Wendy's workers and Burger King workers. I use fast food industry as an example, but it would be the biggest expansion of union rights since President Roosevelt's New Deal. And of course, I'm running on a $15 minimum wage. That's $31,000 a year. In the wealthiest country in the world, that's not too much to ask for. And then justice, it's not just criminal justice reform. I was in high school my senior year when Michael Brown was killed. But I also understand that the feeling a Black mother has when her kid walks out the front door in the morning isn't really all that different from the feeling that the spouse of a police officer has when they see them walk out the door in the morning to put their lives on the line for our communities. It's not just criminal justice reform. Justice is about economic justice with a fair tax code, bringing economic justice with raising taxes on the wealthy, closing corporate tax pass-through loopholes. It's educational justice with forgiving up to $25,000 in federal student loans. For the cost of that tax cut that Ann Wagner voted for in 2017, we could have forgiven every single federal student loan in the country. And when I'm going to these high schools and colleges, I'm telling these kids that it's like who you vote for really does matter. Every single federal student loan in the country. So it's not really a question about possibility, because everyone asks, how are you going to pay for it? It's more about priority. Ann Wagner is prioritizing the wealthy and the well-connected. I'm just prioritizing the middle class, the working class in my district.
Ellen, you have your hand raised. Please unmute yourself.
Yeah. Have you met with the DCCC?
I've talked to them, but they're not.
How did it go?
Yeah, they're not getting involved in the primary, but
Mhm.
I've had great conversations. Someone asked me, House Democratic Party, the National Party has been nothing but helpful. And I can't say that I've had anything but great experiences with the D-Trip and the National Party.
I've got a question.
Yes,
Um,
yes.
When you initially called me, you wanted to talk to me about Social Security. I
Yeah,
assumed
maybe-
that
yeah,
you were targeting that subject with me because of my age. And I deflected you from talking about that at that time because there are other issues that are more important to me, such as public education. But I would like you to talk to this group about what you would have said to me if we had had that conversation about Social Security. And also, right before you came on, we were talking about Medicare. And you mentioned that you would want to extend Medicare for all. Medicare has problems. It is not, and because of legislation that's passed in the last 20 years, people have choices between traditional Medicare and then Medicare Advantage plans, which allow them to still have private insurance. So I would like you to talk to this group first about Social Security and then about Medicare and how it needs to be shored up or improved, or, you know, what President Biden is proposing that may or may not get into the human infrastructure bill that Joe Manchin and Kirsten Sinema are holding up at the moment.
Yeah.
We've got all afternoon.
Yeah. So I guess where you started with, after you said that, I think this is like important to say, I am young, but we're only getting better every day. Like I haven't made that same mistake to target someone based on their age or their gender or their background. I'm really taking a stance where I'm just listening to folks and then telling them where I stand on issues. But Social Security, you know, it matters to me because, you know, that's my grandma. She's 81 years old now. It matters to me that she, you know, gets her checks and that she will continue to get Social Security checks in the future. So we definitely need to expand Social Security. It's about working with Congress on how we do that. But that'll be in the platform later this fall as well. And as far as Medicare goes, you know, folks just shouldn't have to go to the hospital or shouldn't have to decide whether or not they're going to go to the hospital or see a doctor because they might go broke. You know, that should never be a conversation or anything. This is the wealthiest nation in human history. We have an obligation to protect our citizens and keep them healthy. I'm not getting any sound from you guys. Can you hear?
Susan, we're not hearing you, Susan.
Not hearing me?
Now
Yeah,
I
I thought
can.
you were speaking, but we couldn't hear you.
No, I wasn't speaking.
Oh, okay.
I was thinking though, let me say this. When you talk about Medicare, Ray, Medicare doesn't cover everything. And so,
Yeah.
I mean, I'm still learning about this as a person who recently crossed into that senior citizen 65 area. It was shocking to me that Medicare is not an all-inclusive program and that people have to buy additional insurance to cover things that Medicare doesn't cover. As a congressperson, is that acceptable to you? It's not actually, Medicare is not single payer. Medicare doesn't solve all those problems of people not receiving the full care that they need. There are still issues where Medicare recipients get bills for things. So, and I know that President Biden is looking to expand the services that Medicare provides, and that we don't know what's going to come with the renegotiation of his plan. But I mean, he was talking about dental, hearing aids, and vision coverage. But there are, you know, that's not even part of all of it that isn't covered. There's issues with medications. There's I don't believe it covers all of hospitalization in all cases. So are you prepared to deal with that as a more complex issue, or do you have a learning curve?
I think there's always gonna be a learning curve, but it's like you said, yeah, it is unacceptable that, you know, our benefits aren't good enough. But what also is unacceptable is that we have folks who are walking around who don't have any health insurance, and they get sick, get ill, pass away because they wouldn't just go see a doctor or couldn't afford to go see a doctor. So that's definitely my priority, is making sure that folks who are uninsured get insured, making sure that folks who have lousy insurance now can get insurance, and making sure that our union workers get to reap the full benefits they work so hard for.
The other thing is that people tend to talk about Medicare for all. They don't talk about Medicaid for all, and Medicaid is supposed to cover those people in our country who have lower incomes and can't afford to buy their own insurance or are under the age of 65. I mean, I have to be honest with you. I believe in single payer health insurance. We have other members of this group that do not believe in single payer, who distinguish between universal coverage and single payer. We have a crisis in this country of millions of people who are either uninsured or underinsured. And even those of us who do have insurance end up with bills because of deductibles that are surprising and that cause us to wonder whether or not we really do have insurance or what we're paying our premiums for. So just a heads up to you, this is a very complex subject, and I hope you're able to discuss it with in greater detail in the future. I suspect that you're going to find that the other two candidates for the second district will be better versed on this subject, and you're going to have to up your game.
Understood. And like I said, we're only getting better. We're definitely taking a look at healthcare, Medicare, and Medicaid on state level, but we're still taking a look at it. But rest assured, we'll be on top of it.
I see Al Gruber's hand is up.
I see the question in the chat. Absolutely, I'm going to hold Ann Wagner accountable for January 6th. I think she's just as responsible as Trump. I think every Republican who has spouted has expressed doubt in our voting system integrity. They bear some responsibility for January 6th. Trump just lit the match on the gasoline that they've been pouring on that fire for years. So absolutely, we're going to attack Ann Wagner on January 6th. But go ahead.
Al Gruber, do you have a question?
Bet. Okay. I think you'll find a lot of the people in this group have worked on campaigns or run for office themselves. So our questions some of us may be a little wonky. Like on the campaign itself, not policy or anything, but just the campaign itself. Who do you have helping you? Do you have a company, or do you have a friend as your campaign manager? And what do you think your budget is going to be for the primary and then for
the primary will cost around $300,000 to $600,000. It's going to be a competitive primary. Trish has I know it's of money. That's also why we launched on January 6th, because I know they're going to post big headlines that they raise so much money in the third quarter. The fourth quarter, there's just less money to go around with the holidays, and folks just have less money to give to candidates. So I actually filed with FEC back in May. I was the first candidate to file, and I've quietly been, asking folks for dollars, getting all those pledges, but we haven't gotten any checks yet. We started getting checks yesterday, October 1st, in the fourth quarter. The fourth quarter is going to be my first quarter for reporting, so we're going to post a really large fourth quarter compared to the other candidates. As far as who's helping me, we are in the process of signing on 2 Obama 08 staff members. We've got some folks from Sunrise coming to help us out, and a couple of things that I can't really talk about yet. But young people are leading the way for us, and as far as field goes with the high schools and colleges, we've got kids at Mizzou and Mo State and UMKC, WashU here, Webster University here, all pitching a couple dollars to help us out, making phone calls for us. The folks who are close enough to the second district will be knocking on doors for us. Like I said, we get our initial strength from young people.
Harvey, is that a raised hand? Do you have another question?
Yes, absolutely. More of a comment, I think, hopefully helpful, and something I'll probably share with all the candidates. Ray, you you've indicated that you don't want to sound like the folks who have run before, and I appreciate that. And I was thinking about one of the things that hasn't happened again is appealing to the business world. One of your three legs of your platform is healthcare. And, you know, businesses struggle with paying for healthcare and giving all that kind of coverage. I would think that it would be beneficial for businesses to decouple healthcare from employment. So that may be something to investigate and think about as a platform.
Yeah, and I've heard some of that, but I'm gonna be honest. If those employees aren't getting that health care from their business, that means they have to go out and they have to pay for it themselves, while often not getting paid a fair salary.
No, it means no. That's not what I was implying. What I'm talking about is if there's health care coverage for everybody through some other means than employers, then that takes the burden off
Government.
the employers. Yeah, well, I'm afraid to use the term universal health care or Medicare for all, whatever you want to call it. I don't know what the current best way to do that is, but it decouples, it takes that burden off the employers. It also allows the employees to move around easier and pursue their dreams without having to worry about pre-existing conditions and is their healthcare plan going to be better or worse if they change jobs or if they decide to be entrepreneurial and open their own business.
Mm-hmm. No, yeah, I'll definitely take that back to the team.
You know,
that's
I've been around.
That's what platforms like this are for. Me listening to you guys.
Yeah, I've been around, you know, politics for a while, and I've been around Democrats forever, and you know, Republicans too. And I just don't want to see you or anyone else be labeled as, well, you know, all you want to do is give away stuff to the poor people. So there's got to be some balance in there. And I know why less advantaged people need help in our society, and I'm all for it. But at the same time, if you want to win some votes outside the Democratic Party, you got to start thinking about entrepreneurs and businesses and what your platform does for them.
Understood. Steve, I see your question in there. I can't give away our strategy, but I can say that we're doing a high school and college tour where I pretty much talk to
Ray, we just lost you.
Just talking to kids about.
Ray, can you repeat that? We just lost.
Can you hear me now?
I can.
Okay. So yeah, without giving up, you know, my strategy, I can say this. I'm going to do a high school and college tour where I pretty much just go around the high schools and colleges, not just in my district, but all around the state of Missouri, standing on auditorium stages or courtyards, talking to kids, not just about voter registration, but voter education. This is a three-way primary where only 10 to 13% of your electorate's going to turn out in an off-year election. So it only takes inspiring a couple of thousand people to swing that race in your favor. And we believe that the work and the energy that these young people are going to bring is going to do it for us. I've been saying this election belongs to young people. But with that being said, yeah, standing on these stages, we're bringing in some really special guests that these kids like these days. And yeah, you guys will have more coming soon.
Look, can I ask a follow-up to that, drill down a little bit more, Ray? So
yeah.
How does that work exactly? Does your campaign then coordinate directly with the principal or superintendent and say, hey, we'd like to, you know, come in and
for the
how does that work exactly?
That's the first contact, is contacting the school or the school district directly. And then we'll get a follow-up. With the colleges, it's a lot easier, but high schools, it's a little bit tougher because, you know, parents and permission and things like that. But usually through high school, through the college, it's their student government organization, or it's their whatever progressive club is on campus. They're the ones who are inviting us to become speakers at their university. And in high school, some principals are letting us do it. Some principals are giving us some interesting ways to still talk to the kids, whether we're not on campus or things like that.
Okay, thanks.
Are there any other questions for Ray? Don, please, Don Logue, I see your hand up.
Yes. Yes, and I put it in the chat, but Senator Manchin has talked about how we should means test all social programs, and he has a problem with not doing that with childcare apparently, and school lunch programs and things like that. What are your feelings with regard to means testing? When is it appropriate?
Yeah, I think Senator Manchin is wrong. To put it plainly, we don't have time to wait. That was the same kind of thinking he brought to the American Rescue Plan. Well, maybe we should do just a little bit at a time. The cost of doing too little the risk of doing too little is a lot greater than the risk of doing too much. So we need to help as many folks as possible across every single issue, across every single social platform, and then we'll adjust in the future. If it's even necessary.
Well, it sounds to me like you're more in league with President Biden's suggestion for universal pre-K and assistance for all families with child care and the child care tax credit and all his other programs in the human infrastructure bill that he is trying to get through Congress at the moment. And so having another Democratic vote for that rather than having a Republican vote, which the second district has right now, would certainly be an improvement. Is there anything else that you would like us to know? Oh, Don, you
Just
have
to follow up on that though, but taking childcare as an example, do you believe that should be means tested?
I just tweeted like maybe
Can't hear you, Ray. The sound is not working.
Can you guys hear me now?
Yeah.
Yeah. So I just tweeted maybe like an hour ago now with my friend who's running for Congress in Champaign, Illinois. I want to expand the child tax
You sound again.
tax credit increase. How about now?
Yeah. You're floating in and out.
Okay, so yeah. Sorry, how is this better?
Yes.
Okay. So yeah, I want to expand the child tax credit in Congress. I've talked to David Palmer, who's running for Congress in Illinois. He's a great guy. But no, I don't think that should be tested. By doing that, President Biden cut the number of children living below the poverty line in half. We need to get that number to or near zero. This is, again, the wealthiest country in the world. No one should be too poor to live, and certainly no child should live below the poverty line.
Are there any other questions for Ray? Going once, going twice. Ray, is there anything you would like us to know about you that you haven't covered, that our questions haven't covered, or you haven't mentioned yet?
Yeah, I guess two things. One, this primary is about who is the best person to put against Ann Wagner. I'm not a perfect person, like by any stretch of the imagination. I'm gonna make mistakes, but I'll always be honest with the folks who send me to Congress or send me to run against Ann Wagner. And I'll also lean on them and look to them for support and help and guidance through this process. At the same time, I'm just really excited about this opportunity, and it's a great experience. I'm hearing so many stories from folks. I'm meeting people from all walks of life. And what I love is that, you know, we're having like sort of virtual town halls with like some known folks throughout the community, and we're just seeing people from all races, all places, coming together, Republican and Democrat, and even in a primary, to talk about this 24-year-old kid who thinks that we can fundamentally change the way politics works in Missouri, just by running for this office, trying to make a difference. You know, I'm not really cynical. I'm more of an optimistic person. If we're always saying that, hey, this race is over, they're going to cut this district up, there's no way a Democrat can beat Ann Wagner. Well, certainly if we never try, we're never going to beat Ann Wagner. But it takes us to try and keep trying and keep trying. So I'm in this for the long fight. I'm not ready to give up on Missouri 2nd District. I'm not ready to give up on Missouri Democrats. I'm not ready to give up on Missouri itself. That's why we named this committee Read for Missouri. So yeah, I'm just really excited at the opportunity. And thank you guys for having me. Sorry the schedule got mixed up, but I'm glad I did get on the call.
There's one thing I would like to say to you in closing, and that is if you do win the primary, please include Trish Gunby's as an advisor on your team. What she did by flipping her district from red to blue was pretty amazing. And she obviously has some campaign strategies and approaches that are worth paying attention to. And the other thing is that I'm a constituent of Cori Bush's. I live in the 1st District. And the upset that she pulled off in beating Lacey Clay was phenomenal. And so I don't know if you have a relationship with Congresswoman Bush, but I strongly advise that you develop one, because again, in terms of smart politics, what she did was extraordinary. And you need the kind of thinking that both she and Trish represent from different, you know, they have very different perspectives, but they both succeeded where one wouldn't expect success. And, I hope that you seek out their advice and mentorship.
Yeah, this summer I've talked to a lot, almost all of the members of the Congressional Black Caucus. And that's another thing, because of my age and my background, my race, I have access to resources and money that the other two candidates don't have access to bring it to Missouri in this district. But no, definitely talked to Cori, told her how amazing she is. And that's also the reason that when I met Trish for the first time, I told her like, hey, we're going to be completely respectful. I admire you. You are amazing. You've done a great job for Manchester, because if I do win the primary, I'm going to need her. This campaign is about building a broader coalition, and I need Trish's portion of the electorate to beat Ann Wagner. The same strategy that President Biden had to win his primary. He didn't attack the candidates personally in those earlier debates, even though they were all taking jabs at him. He was pretty much nice with everyone because he knew he would need the entire Democratic Party to come behind him to beat President Trump. So it's kind of the strategy we're taking here.
I wish you luck with your campaign. And as we get closer to the primary next August, I hope we hear from you again. We will be inviting Trish Gunby and Ben Samuels to address us. And we'll need to hear from you again as things get closer to the primary. Have a good campaign, and thank you for talking to us today. You're welcome to stay for the rest of the meeting. We're going to be discussing Social Security, actually.
Then I need to stay on this call. I'm going to listen.
Okay, so with that, the next portion of our meeting has to do with Spotlight on Ideas, and Marty Walsh is going to spotlight Social Security for us today. Marty, you're on.
I was going to talk about, I want to send a note to Steve, Social Security and Medicare prescription drugs. But I'm more prepared for the Medicare prescription drugs
Take it away.
But I can always talk about about Social Security. But no, the Medicare prescription drugs to go over, then that's a lot quicker. You know, the pharmaceutical industry wrote the law, and they said that Steve Sanger is a great guy. He ran his job the way he should, because you should not be allowed to negotiate. You should just take what the other guy wants and give it to him. And that ended him up in jail. But so, you know, that the ability to negotiate is important. And the reason why I prefer that now, because it's a topic now. There had been a letter to the editor in the newspaper that I was responding to, saying how if they negotiated, it would just destroy the whole pharmaceutical industry, and we would never be able to get the drugs we need, and the costs would go up and all kinds of garbage. And I saw an ad, just one, about a month or so ago, alluding to kind of the same thing. And the response is very simple. The VA and Medicaid have negotiated for years, and it has not destroyed anything. So it is very possible for Medicare to negotiate drug prices. I saw an article a couple of months ago where just on insulin alone would save Medicare like $2 or $3 billion a year. And I've seen others, totally they could save about $14 billion by negotiating the Medicare prescription drugs. So, and thinking about it recently, as we were just talking earlier about private insurance companies, they don't have to pay the high Medicare price for drugs, and that's growing portion, as we had mentioned, of Medicare. And if that's not destroying it, I don't know how letting Medicare join everybody else and paying the lower price instead of this exorbitantly high price that Medicare has to accept. I mean, it is the only place in the whole United States where we are not allowed, the government is not allowed to negotiate or get competitive bids or do something to keep prices down. So, and I said, Steve Sanger's probably kicking himself because he got into the wrong end of the business. So that's what I wanted to talk about with the Medicare prescription drugs.
Does anyone have any comments based on what Marty just said? Or questions? Al, and you're muted. You have to unmute yourself.
Thank you. Okay. As I listen to this and as I've thought about it before, it seems that this particular issue, there's no principle. No principle. It's pure power. And pharmaceutical industry gives so much money out. Hold in their chits, got this voted in. We've got to counteract it. How we do that we got to talk about. I mean, it's like perhaps certainly got to get the people elected and that over, and we're sort of right on the edge of that right now. We probably need a few more. So anyway, that's my reaction to this. Really, we just got to talk about how we're going to build enough power.
Okay, Don Logue, you have your hand up.
Yeah, I agree with the concept that Medicare should be able to negotiate. At the same time, I think, we have to take into consideration how the development of new drugs is funded. And I think in addition to, allowing the government to negotiate, we also need to make sure we pay attention to funding research in our universities to address and to work on developing drugs that the private sector just simply is not going to pick up on. So it's a little more complicated than just saying, hey, we're going to let Medicare negotiate, because I can tell you right now with the Medicaid program, we have a lot of people who are denied healthcare services simply because we don't have providers that are willing to participate in dental and all the way up and down the list. People just don't have access because doctors and other providers, nursing homes, they lose money in Medicaid, so they don't provide the services. So we have to make sure that we step up to the plate and fund that social infrastructure concept of drug development.
Let's see, Al, your hand is still up. Does that mean you have another thing to say or no? Anyone else?
Well, I'll give one other reminder that I'd forgotten earlier, and that is, when they wrote that prescription drug bill, as I said, Medicaid pays lower, and when people go through all their money while trying to get health care, long hospitalizations or nursing home, whatever, the patients who are on Medicaid and Medicare paid the lower Medicaid prices, but the prescription drug industry, when they wrote their bill for the Republicans to put through, changed it so that these poor people have to pay the higher Medicare price for drugs, which is beyond being evil, I think. So.
Okay. So basically the solution is getting more Democrats elected, which is what we are always trying to figure out how to do at MOPAG.
Caveat, more Democrats, not like Senator Manchin and Sinema, but
Yes,
Right. Yeah.
yes.
Democrats that understand the issues.
So flipping the second district is a priority. Getting a Democrat elected to the US Senate from Missouri next year is a priority. And we'll see what happens from there. Okay. Do we have any issues to be brought up for open discussion? Suggestions on future speakers? Or let's see.
So I did recommend
Current events, local issues, or member activities?
I did recommend or passed on the name of the Violence Prevention Commission director as a possible speaker. I think that's something we, could pursue. Again, getting that person could be difficult because they have a pretty busy agenda, but, violence is a huge issue in our community today, and the better understanding we have on everybody's part, the better, I think.
I'm kind of curious to know what kind of violence you're talking about, because one of the things I've been concerned about lately is outbreaks of violence at county council meetings, at school board meetings, on airplanes, at the doors to restaurants and stores. There seemed to be a lot more violence on a daily basis from people who we don't tend to think of as being usual offenders. So, and they don't also seem to be being punished for their violent outbursts, or there don't seem to be consequences for what's going on. Is that the kind of violence you're talking about? Or are you talking about more traditional forms of violence?
Well, I'm talking about the full spectrum, and it is a complicated discussion. As an example, one of my childhood friends, who I think probably had mental health problems, murdered his father murdered his brother and shot his father. Okay, now one day he's a law-abiding citizen, the next day he's a murderer. Okay. It's so many people want to take the position, well, we just need to hire more police officers and lock more people up. We have huge systemic issues that need to be discussed here that we're not talking about. And a lot of these things are, particular to the culture of this country. So,
in the city, we have a new mayoral administration who's trying to address the kinds of issues you were just talking about by hiring more mental health professionals and social workers to respond to certain 911 calls instead of the police. It's a controversial approach, and there's been some pushback to it because in the city we have considerable amount of violence of the more traditional types as well. But we may get to see, I would suggest you keep an eye on what goes on in the city and then see if what new approaches are attempted here are applicable to the county if they are at all successful here.
Well, and I think that's what's playing out. Okay. I'm on the Violence Prevention Commission's subcommittee for municipal engagement. Okay. And the problem needs to be addressed because that commission is not on the radar screen of our county officials. And I know this because I talked to them and say, well, we don't know anything about it. Okay. And to take a big jump. So much of the focus is on the activities of adults, okay, without a discussion of why is it that these adults went down that path to begin with. And I think this again gets back to how are we supporting our children, pre-birth, okay, and their parents. How are we supporting these families and households in nurturing our children to adulthood? And that's not being discussed enough, but it's a part of the package that is being debated in Congress right now. So it's a much more complicated discussion than hiring more police officers or even hiring more social workers. We got to think upstream, okay? Because our numbers compared to other modern, industrialized countries is pretty poor. Our outcomes are horrible. And so we've normalized, not supporting, our families and our individuals, and we need to have a deep discussion on that.
Right. Okay. Anything else anybody would like to bring up?
Well, Susan, if unless there are other topics, I'd like to bring up our next meetings.
Yeah, which our next meeting in November is November 6th.
Right. And maybe we could have a board meeting Sunday on the 10th of October at 1 o'clock.
Okay.
That's the 10th of October. Let me double check, make sure. Yeah, 10th of October, Sunday at 1 o'clock. We'll have a Zoom meeting, and we'll put out an agenda and bring some ideas. I've got a number of ideas for future speakers and some of the work we should be doing. And so if that's okay with everybody, we'll plan on doing that.
Okay.
Oh, one other thing I wanted to mention. So Al Gerber and I were at the Central Committee meeting for St. Louis last night. And we have a new permanent chair, Nelson Mitten, And the vice chair is Jessica Labozetta, who has also been functioning as the secretary for the Missouri 2nd Congressional District Central Committee. So there's been some rearrangement of the chairs. This is because Mary Elizabeth Dorsey resigned last month.